thinking about to lock down or not lock down, I mean, I think this paper doesn't really offer much help on that question. I mean, firstly, it's only looking at a small section of considerations, whereas the broader issue about how to respond to COVID epidemic needs to consider much more. This is only looking at COVID and HIV, TB, and malaria, not considering anything else. But even within that, it sort of says there's no good options. It doesn't say, for instance, that one option to lock down is definitely better. What it does say, if anything, is that you might get different types of disruption and you might need to mitigate them differently. So, for instance, if you're going to lock down a country for months and months and months and months, that might well have a big effect on reducing the COVID-19 pandemic. But it will also have really serious consequences on people not being able to access care services and receive the medication and so on. But if you don't lock down, well, then you're going to probably have a much larger COVID-19 epidemic and as well have lots of disruptions to the services, because health systems will become overwhelmed and people won't want to go and seek care if there is a overwhelmed health system going on. So this study doesn't really say which one of those things to do. It says this is when you're thinking about how to minimize the entire impact of the COVID-19 epidemic, it's right up there at the top of the list to also be considering the continuity of service of these other major health programs.